Southeast Europe. A wide number of states have ratified the optional protocol to the UN Convention Against Torture and established their national preventive mechanisms to monitor places of deprivation of liberty at a national level. So to enhance the NPM cooperation, 6 NPMs, namely from Albania, Croatia, North Macedonia, Montenegro, Slovenia, and Serbia, have established this network that is basically self-led, the Southeast European network. And since then, the network's main task is to support NPMs from the region to effectively implement their uphold mandate. The network provides a forum where knowledge and experiences regarding human rights standards and monitorings are shared among peers.
NPMs can play an essential role in exchanging the implementation of safeguards in practice due to their extensive monitoring powers, allowing them access to all places of detention, all persons deprived of liberty, and all information. Private interviews with detainees, including at later stages of the criminal justice process, and the access to registers and any other documentation in police custody and beyond are, for instance, one of the key tools enabling NPMs to check upon the reality of safeguard implementation in practice.
Something that we are very proud, because under the recommendation of the ombudsperson, the NPM, they managed to create a register in order to all the police stations to create a register with a column where they can put all the details, the name, the number, and the time where the people call their families or their relatives.
Well, the COVID-19 pandemic is a global phenomenon, and unfortunately it affects every country, so the Southeast European region is no exception. At the beginning it was very hard to continue the visits. We have had a high number of COVID infections, and this required employing a higher degree of caution, of course, when performing our mandate. Some of the NPMs in the region have suspended their regular work, their visits more precisely, and engage in alternative methods of monitoring, while other NPMs have decided to continue performing visits, but respecting prescribed epidemiological measures.
Right of the access to healthcare, it's one of the 3 main rights who are procedural safeguards in the first hour in police custody. And generally speaking, in the countries of the region, this access of the person deprived of their liberty to healthcare is legally regulated. This right should not be limited to emergency medical care only, but should include the right to health care in the full extent.
The problem might be with ambulance doctors, because my experience from own country also indicates that these doctors are not properly trained. Most of them don't have a proper knowledge of issues of ill treatment and of access to a doctor as a safeguard. So they just see a person in police custody as a healthy one, as a person who is exaggerating or whatever, and they don't perform a proper examination.
I am of the view that it is essential to continue visiting police stations unannounced, including during the current sanitary situation. One needs also to draw a distinction between, on the one hand side, emergency medical assistance provided to detainees in police custody, and on the other hand side, an effective right to access to a doctor as a means of preventing ill treatment.
These times, although challenging and very, very difficult and extremely sad, has taught us something, taught us to be strong and to adapt to new circumstances, to show our flexibility, our knowledge that can be adapted to any challenge.